Hi, I'm Neil Gross. I'm the PI for NRG-HN014, a randomized registrational intent phase 3 trial for patients with resectable cutaneous squamous cell carcinoma. There's been a tremendous amount of excitement around this trial. You know, there's been a real lack of data for patients with advanced cutaneous squamous cell carcinoma. It's been a blind spot for industry for so long. In fact, there's only been 2 prior published randomized phase 3 trials for these patients ever. So there's really pent-up demand from patients and from surgical and radiation and medical oncology colleagues for better options for these patients. So there's a lot of excitement around the trial and how to apply a new approach for these patients. So we're testing a neoadjuvant strategy for patients with advanced resectable cutaneous squamous cell carcinoma. They get 2 doses of neoadjuvant treatment. If they're responding, they can get up to 4 doses, and then really dramatic response-adapted treatment where patients who have a complete pathologic response receive no further treatment in the experimental arm. So there's a lot of questions about how this is done, the details of the neoadjuvant approach and that adaptation. But if we prove this to be successful, then it would change the standard of care. This would rewrite how we manage this disease for future generations. And that's so important for a disease that affects patients so dramatically. You know, these cancers predominantly occur in the head and neck space and can have a huge impact on quality of life and function, and these outcome measures are also embedded in the trial. Well, we hope that this trial is positive. We're just activated and launching now. We're in this ramp-up period where sites are coming online and we're accruing briskly now. So we hope that this will be positive, and if it is, then it'll be the new baseline, the new foundation for future research in this space. You know, not everybody responds to neoadjuvant treatment, and we'll learn a lot, hopefully, about which patients those are and how we can better titrate treatment and focus treatment on the patients who will benefit and move to something else in the patients who will not. I think it's important that we just keep in mind the big picture with this, in the sense that accrual is just so important. There's so little data in this space, and so now is the time to put patients on the trial, answer the question. There'll be so many more questions to come, but we need to answer this question first to kind of open up the next chapter for this disease.